5, 1, now. Hey, there we are.
Welcome
David.
back to the Demand Better podcast, your ultimate consumer's guide in the health, fitness, and wellness space. We are sponsored by Fit Care Physiotherapy and Wellness, where the emphasis is to focus on your fitness so you can avoid the healthcare space. I'm your host, Corona, coming to you from the concrete jungle of New York City. And joining me, as always, from Erie, Colorado, is my esteemed co-host, Dr. Bo Babenko. What's up, Bo?
Living the dream, coming up off some bronchitis. It's going around. It's lingering. Having kids in daycare. I think, Marco, you have some kids, right?
Yes, I do, sir.
Are they in the daycare?
Yeah, no, well, they are in the school today, fortunately. Okay. But in 1 hour, they're going to be here. So it's like, it's going to be very crazy. If you hear some screams, sorry for that.
All good. Just saying, we understand. So yes, doing great. David, Marco, where are you located right now?
I'm in South Florida.
He's done with my people.
Yeah, the Cubanos.
So let me introduce who we're talking to so people know exactly who we're talking. Today's guest is Marco Benitez, CEO and co-founder of ROOK, a former Tae Kwon Do national champion turned biomedical engineer. Marco worked at Roche and Novartis before his entrepreneurial breakthrough at just 22 years old. While still in college, he built and sold a machine learning system for hospitals. In 2017, Marco co-founded ROOK to solve fragmented health data problem. ROOK integrates data over 400 wearable devices through a single API, providing companies with one unified integration point instead of building hundreds of individual connections. Join us as Marco shares how he's transforming the health data into an enterprise value. Bienvenido, Marcos. What's up, my friend?
Muchas gracias. It's like a really good energy here, so I love it.
Let's go. So, Marco, tell us, Corona. I've listened to a lot of your podcasts going into this as well. You're all over the place. People can look you up everywhere. David just mentioned it in our intro there. So, what is API before we get into a few other things?
I mean, if you go literally, it's the application programming interface. So basically, it's a backend. We are a code. It's a code where you can put a lot of things in one space. So that's the API. On our case, API, you keep a lot of wearable connections, but we can go after that.
So why don't you give the listener a little background on yourself? So you have, even though I gave you a little background, why don't you give them a little background about who you are and what ROOK is?
Yeah,
is that how you say it? Is that how we're saying it?
No, but it doesn't matter. At the end of the day,
I'm Latino. I like to roll my R.
Exactly. No, that's perfectly fine. I mean, by the way, the name was something very crazy, but it's like here in the US, it's like ROOK. I cannot not pronounce it well, and when I'm pitching with different investors and clients, everyone is telling me like, how do you pronounce ROOK? And I don't know, please let me know. You are the one who speaks English. I don't speak English. It's,
Does the name come from chess? Because that's what I think of, like the rook moving in chess.
Everyone told me that. No, it's in fact, it's when the crows are flying, they are flying. And the crows are is one of the most intelligent bird in the world. So they are all together flying. That's the moment where that's a rook, in fact. But also it's a chest, which is very fun. But yeah.
We're learning about birds here. This is great.
Yeah. That is a murder of crows, not just the murder of crows. We have the rook. Is it a rook of crows? Okay, we're gonna go ahead. Tell us.
Yeah. Well, I'm a biomedical engineer. I love biomedics. I love data. My background also before that, I was a sports, Billy. I used to train Tae Kwon Do, became national champion. That's why I travel a lot to Cuba, because in Cuba we do the best. I will say that the best fighters, after Mexico, of course, it's Cuba.
La Finca.
They are so great, and we have really good sparrings over there. So that's where I train a lot in Cuba, and then do a lot of back and forth between Cuba and Mexico. But I love Tae Kwon Do. Tae Kwon Do helped me a lot to, create these values of discipline. It's very important to build anything in this world. You have to have a lot of discipline and perseverance with everything. So that allows me to create what we are building today. And after first company, then work in the big pharma industry, working with clinical trials, working with data, working with people, analyzing the FDA approvals, drugs, and everything, we decided to build again another company, but was on top of data and on top of, I am a geek in terms of wearables. I love wearables. It's like tracking you all the time and trying to analyze. Yes, you have a Goop. I have a Goop. I have a Nora. I have an Apple Watch. I have a CGM. In my bed, I have the 8 sleep. And the reason of all of that is because we are testing our API. But at the end of the day, I really love this information because it can give you so many insights. So yeah, that's a little bit about me.
Well, let's get into wearables, man, because this is your wheelhouse. And even though I'm in the fitness field, I have people that we track, and Bo also has people we track. You said, and listen, what you said is the same thing I believe, and the same thing Bo believes. Exercise is medicine.
Yeah,
it's more than just a buzzword. With your pharma background, how do you see the limitations of the traditional healthcare that led you to focus on the wearables?
Everything should be on the preventive side. Yeah. Everyone should be more on the preventive side rather than be reactive. Because once you have the problem, it's like you don't have too much to do. It's like probably you will take a drug or you'll probably take a specific thing for you. But a lot of the diseases that we have today, you can prevent them. Of course, there is genetics, and there is something that you cannot fight about it. But it's at the end of the day, if you sleep well, you have a good nutrition, you do workouts, you steps, and you are less stressed, and everything will help you eventually. So I think that wearables and all these type of things will help you to understand your behaviors. And that's the important thing. It's allow you to have more information about yourself. Once you have information about yourself, you can take better decisions. That's the theory. Information, you check, you make relations, and then you take decisions. That's the important thing. Big pharma, I think at the end of the day, they are trying to understand the problem once it's already there. And it's okay. It's perfectly fine, because sometimes like cancer, oncology problems are so difficult because it's not one thing. It's too many things at the same time that at the end you have a specific problem with cancer or these oncology diseases. So yeah, I mean, the new medicine is moving. That's why there is a huge wave of medicine 3.0 around the prevention side, which you can take it. And I think
can we just stop there and break down between the medicine 2.0 and medicine 3.0, if you don't mind?
Yeah, of course. The medicine 2.0 is when you have already all the. Let's go back one step. Let's do one step back. Medicine 2.1 is when you have heuristic ideas, when you have all these learnings from your medicine, the traditional medicine, and you take decisions on top of the information that you have from the previous experience and also from books and everything. That's the medicine 1. The medicine 2.0 is when you have all these medical devices, you have the tomography, you have all these devices that can allow you to have more information about the people who is behind the patient. You have information to take and then apply a specific drug, apply a specific thing for that, for the health of that people. But it's more on the reaction side. It's nothing around the prevention. And the medicine 3.0, it's all around prevention. Okay, we know the problem. We know that because the heuristic thing, we know that I'm a doctor. I have all these tools that allow me to have all this information from the patient. Now it's like, okay, maybe we can do prevention with all the things that I know that will happen eventually. And that's where everything it's built on the medicine 3.0.
Yeah, it's got to be difficult. In this country, everything's reactionary. You know, that's why these wearables that you brought in are so valuable. At least I think so. They're valuable. But the issue at hand is the general consumer doesn't know what the hell the data is. They don't understand the data, and they don't understand how to process the data. So my question is, with these wearables, people are buying them. What is your suggestion in terms of understanding the data for them to get the most out of these wearables?
Yeah, data is something really complicated, honestly, and more in this world that we are living. We receive data for so many places, right? So we receive data from your phone, we receive data from the TV, from this laptop, from this podcast, from different podcasts, from, and specifically with these wearables, it's like it's too much. In fact, for example, if you have an Apple Watch, the information that you receive in the Apple Watch is
It's a
it's
lot.
so much, and it's very difficult to understand everything, right?
David
It's
actually has an Apple Watch. David, do you want to talk a little bit about your Apple Watch? Any data you get from that? How do you use it? Is it just there? You just happen to have it?
No. I use it to train when I'm training a lot. The reason I use it when I'm training because I like to keep my heart rate in a certain area. And I also I'm also a journal person. So I like to journal how I feel on that given day so I can actually reflect on what the numbers are for me. Some days are better at being at the age I'm at. Not every day is going to be perfect. At 57,
Yeah.
I work out all the time. Hey, it's going to be hard some days. If I don't get a good night's sleep, I'll pay the next day when I go to work out. I won't have the best workout, but I think it gives me first of all, it gives me a way to monitor my clientele. They don't know it's on. Let me see your watch. And they'll be like, what are you talking about? I can see the steps they're taking. I can see a lot of things that are in there. And then I can also get them to turn it on. The issue is they're not taking that information in the way I'm taking that information in.
Yeah.
I could tell you exactly what I did in each program cycle that I go through. I can tell you what my heart rate zone was. I can tell you how many calories I burned. I can tell you how long I worked out. All those things are valuable to me so that I can make an informed decision for the next step in my programming, as well as the next step in my client's programming. But I don't think people use it in the same method that I use. I think people use it less than that.
Let me give you one number because that for me was very impactful. At least 60% of the people who is using an Apple Watch, it's just an extension of their phone.
Yep.
The other 30% or 40% or less, or even less, they are using for information to track a specific exercise, like go out and run, go out and do some workouts, whatever. So it's very sad, that number, honestly. And it's an extension of your phone. Um, and on the other hand, we have the new wearables. Of course, we always had Polars and Garmin's and Huawei's, and now the new era of Whoop and Aura. Okay, by the way, was yesterday they raised 900 million in evaluation of 11 billion. So it's crazy. I don't know how does that looks. 11 billion of valuation in one company. It's crazy. But to the point, it's like doing something with the data. It's very difficult. Someone with your experience, Corona, this is something that really makes sense. But what happened with every single one who is outside walking and trying to understand a little bit more about their health? Yes, you can go with a coach. Then yes, you can go with Corona, and he will tell you exactly what you need. But also, what happened with all the other people who want to do something and want to start with something? It's very difficult at the very beginning to start with something. So now the new wearables are starting to do something, the next step, which I think is the Whoop and the Auras are trying to make something with the data. But still, we are in the early steps of this information, because what you can see in the Whoop, it's okay, I have a readiness score. Interesting. What happened if I drink the last night? What happened with my night? What happened with my stress levels? What happened with my strain? What happened with, there's a lot of things that happening, and then you change behaviors. Right. Yeah. There you go. That's exactly. And the Aura Ring has happened the same thing. And the Fitbits of this world and the Googles, they are trying to move towards, identify specific biomarkers or something that allow you to do something with that. I think we are changing now the things with the wearables. Now they are approved by the FDA. That's amazing. I mean, have an approval from the FDA for specific things in these wearables. I mean, it's amazing.
Yeah.
Now our medical devices, right?
So you probably know better than me. I saw there was a little bit of controversy. I got the latest Whoop. I assume you have the same, the medical grade, the MG. For those who don't know, they added for this version the ability to do an ECG. So you just put your fingers up on there, and it'll kind of detect your heart and tell you if you're having AFib or anything like that. And it also has a proprietary algorithm for tracking and keeping an eye on blood pressure. So those are two of the interesting new things that at least the Whoop is doing, as well as having this new longevity. They put out their score. What is it called? The age, the
longevity age.
Longevity age. Yes, they have a specific name for. Yeah, but anyway, so yeah, I don't know. In terms of, again, it sounds like you're more on top of all the other ones, Aura and the other likes. What do you think about that? Do you think? I saw there was a little back and forth with Whoop and the FDA. Where are we at with all that?
Honestly, I love the idea that you can read your blood pressure on your Whoop. I think the other one who is doing this type of thing is Huawei. They are doing also a very good job on the blood pressure side. I started to, because once you start to track your blood pressure with the Whoop, now you have to recalibrate with your blood pressure, your barometer.
Manual cuff, yeah.
Yeah, exactly. So it's like it's very accurate, honestly. But I want to hear from you, Dr. Poole. You are the doctor here. And what do you think about that? Because it's like, for me, it's very curious. I think it worked, but I don't know.
Well, I think for the consumer, the listener here, who might not be as understood about these things, I will also reference Dr. Peter Attia, one of the biggest. He also talks about medicine 2.0 versus medicine 3.0. But when he talks about blood pressure, and a lot of the other folks I listen to about blood pressure, they say getting it done in your office, right? If you go to the medical doctor's office, there's white coat syndrome. It might come out, let's say 150 over 90. Oh no, we got to keep an eye on this. Or hey, you're in the danger zone. But he says you need to be tracking it throughout the day, which is what the Whoop is doing. In fact, my blood pressure does run on the higher side from my genetics. I'm going to look at it right now. So it estimates things. And again, I do trust that. And to your point, maybe once a week, and I should probably do it more consistently, I'll go and do the manual, put the actual cuff on and get that reading. And then you can enter that into the Whoop and let these work together. A little bit of what your API, not exactly, but coming back to your company and ROOK and how it's all coming together. And we're trying to, I think, as everyone elevates and puts better information in here, I think it's very valuable. Again, I haven't looked recently at what Whoop specifically, because I use them. But they actually, during COVID, you probably are familiar with this, they actually published a number of studies in the New England Journal of Medicine. They actually showed that they were able to detect infection and being affected by COVID, respiratory infection, better than the nasal swab that you would go and sit in there and get the Q-tip up your nose. And they there's a famous story of, I forget who the PGA golfer is, and he was going to go on tour, and they saw that he tested positive on his Whoop, not tested positive, but they noticed it and said, you're at 1% recovery, even though he was negative on the COVID PCR up the nose. And they said, maybe you shouldn't go on this weekend, competition. So there's a lot of interesting stuff there. I think I recently had two other, kind of founders on through our podcast collective, through Eric Malzone. That's how we got connected here. So Spren, if you know that, do you know these other guys? Spren?
Yeah, very well. Jason, it's a very good friend.
Yeah. So, and we had a great conversation. I'm excited to see what he's doing, as well as Fizmodo. So those guys are also Andrew. Yep. And those guys are trying to escalate and elevate, I think, this conversation. Now, are those types of, is there integration with your platform and their work? I haven't seen anything on that.
Both. With Andrew, they integrate our API because that allows them to have more information. And with Jason, we are doing a lot of back and forth because of our backgrounds. And at the same time, it's very interesting what they are doing with just one picture. They can give you the how they call it,
the body fat scan.
The body, exactly, the body fat and everything. I forgot the name in Spanish and English. Sorry. In my mind, it's always between Spanish and English. Yeah. Probably not sure if it happened to you, Corona, but it's like sometimes my
not
mind
anymore.
is in Spanish. I know. From time to time. But these guys are doing really great, and we are doing a lot of things together. We are very good friends also. But to your point, it's like trying to collect all these data and trying to normalize everything so someone else can use it for a very good purpose. I think that's perfect. That's exactly what we do. We collect data from different devices, no matter which device you have. If, for example, I am a wellness app, and this wellness app want to customize your experience, They want to tell you exactly what type of workout you should be doing during that morning because you have a very bad night and you are very stressed, or you take some drinks in the night, and give you this type of insights, or they give you this type of information, is thanks to these wearables. So they need to know the data, the wearables data from their end users. They need to connect with every single wearable. So instead of doing all these processes, they only have to integrate my API, and then immediately they will have 300 and so more data sources, which are not only wearables. We also have lab testing, which now is something really important in these things. And other medical devices that they know and they need. So customized experience at the end of the day.
Yeah.
Yeah, I was gonna
Go ahead, bro. Go ahead.
I was gonna say, yeah, as a Whoop user, they just put me into the advanced labs, and they just integrated my Quest diagnostic blood markers. I think I put in 61 blood markers, and I was actually also doing work with a functional medicine practitioner to try to integrate all these concepts. I'm also doing a few tests that do not fall under that, but some poop pee saliva collection at home, I send that out. So we're going to integrate all that, talk about all that. But yeah, the Whoop thing, and again, for anyone who's, I feel like there's maybe 3 different consumers right now, or people that might be listening. One person who's never had a wearable and never really used it, maybe outside of, like you said, that it's just an extension of my phone on the Apple Watch. The person who uses Whoop, like myself, and maybe has some understanding of it, or any of the other main ones like Aura or things like that. And then somebody who you're maybe trying to put all these pieces together, either as a clinician, as a business owner, which it sounds like is your end user a little bit, if that's correct.
Yeah, that's correct. We serve to these companies, so we are like a B2B. So it's the third one, exactly.
Yeah. So yeah, just for folks understanding that, and again, like I'll talk about the Whoop, and there's a journal every day, and I can say I had, you have to put in that information. That's the other part. I wish, I'm gonna say I'm being lazy. I don't fill out that journal every day, and I'm like leaving money on the table, so to speak, because I don't want to put, oh, did I have dairy? Yes or no. Did I have gluten? Yes or no. Did I have sexual intercourse, yes, or whatever that is. And it can put all these variables together. I had an actual girlfriend who was an organizational psychologist back in New York, and she had her own Excel document. This is back in like 2013. And she would do all this stuff. What cycle, what time of the month is it for her? Did she hit a PR in working out? She had this all made up as her own Excel sheet. It was pretty impressive. And bottom line is the Whoop can give you that. It gives you weekly performance reports, monthly, yearly, and it'll say every time you have, you put in that you had a drink after 9 p.m., it's decreasing your recovery by 5%. So again, based on that insight, it sounds like, again, you're trying to take all that, put it together, and make it usable. And I'll say the other big thing, big picture, I always fascinated by this, and when I have these conversations, Google Health was a thing. To my understanding, it's not a thing anymore, or it's just very like off to the side. Apple Health is a thing as well, but these are not, they're like, I think they touched in this space, and you might, again, have a little more understanding of this than me, but I saw that in the space, and they kind of said, this is too much. We're not going to make any money here, I assume. They're backed off of that, and they said either we're getting into too many issues with, privacy of people's data and things like that, or they're just saying this is way too much. We can't take all of this data and make it come back to, hey, Corona, we notice you need to stop drinking alcohol after 9 p.m. or and limit yourself to one, whatever that is. I keep talking about the alcohol, but whatever that is.
No, you're right. You're right. That's 100% what happened with Apple and Google. At the end of the day, they are recollectors and they are doing really good job. And that's one start, because they have their own objectives, right? So it's like you as let's say that I'm Whoop, I cannot put everything on Apple Health. And it's like I only have specific things that we can put on the Apple Health. So it's like you will not have all the information of their event. So it's really complicated. And of course, all the things that you said before, it's 100% accurate.
Yeah. Listen, you've been like, I mean, you wear everything, Oura Ring, Whoop, you have the sleep thing, right? I mean, it's someone living in that ecosystem 24/7. What is the most interesting thing that you have found out about yourself? Because I think when it comes down to all these wearables, the consumer wants to know, what am I going to get out of it? So what surprised you? And what is the biggest thing you've taken out from it?
Yeah. Again, learning about myself. I love learning about myself, honestly. It's like, how can I improve myself? It's really difficult mentally, physical, everything. What I learned is what happened when I drink alcohol.
Yeah.
It's impressive. It's really impressive. It's impressive how damaged. It's like you are taking. I wait a moment. I love alcohol. By the way, in
We are,
terms of, I have
somos
a good
iguales.
relationship. Exactly, exactamente. I have a very good relationship with the alcohol. I don't have any trouble. We love mezcal. So on Fridays, I go with my wife. We take a couple of mezcales and sounds perfect. We love it, right? So, um, but that allows me to learn again what happened with my body, what happened with my heart rate, what happened with my blood pressure, what happened with my stress levels, what happened with my sleep data. And it's like it's not only in the whoop, it's, I can see that also in my aura, I can see that in my bed with the 8 sleep, and how difficult it's for me also to sleep better. That's the first thing. And the second one is the stress levels. How can I improve that part? How can I improve by, I don't know, breathe? If I breathe before I take a very important meeting, that's, I can see the shift. I can see the difference between breathing and not breathing before an important meeting with one investor or with someone. It's impressive that you can see that type of information in real time. I don't need to go to a doctor. I don't need to go to a hospital to see specific things about myself. It's real data, and that's
So
impressive, and that's allow me. Yeah.
so let me jump in. So when you mention having five or what's your total number of devices that you have on right now and that you're using? I know that there's the one in your mattress, correct? As well.
In
So
my body today, I have four.
only four.
Yeah. Yeah.
You don't.
Only
So you
four.
took off you had the strap, right? You had the chest strap. You have that off.
No, I have the CGM right now.
Okay.
Again,
Okay.
it's more for the API purpose because I'm the worst,
Right. So,
end
well, I was
user.
gonna say,
That's
as
the reason.
based on being, what you do, your company is it really more for that, or do you think everyone should have multiple devices on at the same
No,
time?
no, 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 no.
I just
No,
want to
definitely not.
clarify that. Yeah.
No, 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 no. Just one. That's
Yeah.
it. That's
So,
perfect.
that's what I'm
If
saying. I have the Whoop. I think, again, it's not, none of them are going to be perfect, but I'd like to think, I really like the founder, Will Ahmed, a Harvard guy. I've listened to him. I really liked them from the beginning. I even, I did HRV stuff back in like 2010 with, what's his name? Joel Jameson. You probably, again, if you're in the space, you probably know that guy, but, and that was the one you had to sit there and lay in bed and put it on first thing when you wake up. And you have to have like 5 minutes of uninterrupted movement. It was pretty unrealistic. We've come a long way since then, but or it was requiring, I would say, a lot. I wouldn't be able to do that with a toddler right now. But bottom line is, I coming back to this whole big picture of where we're going is, again, it comes back and it's still overwhelming to me. And I'm gonna actually share my own personal. I've talked about this a little bit. I'm turning 42 this year. I have not great cholesterol from genetic stuff. My father passed away of a heart attack at 41. So I'm going to be outliving him in 2 months here or whatever. I'm bringing that up to say I'm looking for the answer. My cardiologist, he's looking at my LDL. He's like, you have high LDL. I want to come back to you because you're putting data together. But where does that integration come back to? Hey, Bo, you have high LDL. Your cardiologist wants you to go on a statin. I'm trying to find a way to not go on a statin. That's why I'm doing all this other testing. Based on my understanding, statins are not bad, good, whatever. We can talk about what that is. But yeah, the cardiologist, I want your LDL at 70 because that's going to, based on evidence, based on maybe medicine 2.0, maybe you could argue it's medicine 3.0, somewhat, not really, maybe 2.5, whatever. He's saying if your LDL is at 70, you have the lowest chance of having a cardiac event. I don't agree with that necessarily. I'm certainly, again, diving deeper into these conversations. And his also other point is like, look, you're healthier than 99% of the people that come in here. Otherwise, like, you're fit, you're not 100 pounds overweight, whatever. That's the majority of the patients he sees that they're just like, yeah, give me the pill. So, but he still thinks putting me on a statin is going to continue to minimize the blockage in my heart, to minimize the cardiac event. There's all the other background. You probably know the stats. I'm not going to go too deep into that. I'm doing some other stuff on my channel talking about the research into cholesterol and statins and all that fun stuff. But I want to bring it back to, how does your system and where are you at with integrating all of that data and making sense of it? Because again, as informed as I am, I'm still like, I don't know, like, who do I trust? What do I do? Do I eat more broccoli? Do I have a niacin flush? Do I, can I take red yeast rice, which is a myostatin? Like, so yeah, tell me what my, where are we at? Are we looking at maybe 5 years from now? There's going to be a really good answer with AI.
Yeah,
Where are we at?
exactly. I think today we are collecting the data that we will need for tomorrow.
Okay.
So we are in this process where we have everything very clean. We have tons of data. And now on the next years, we can start to analyze with the lab testing, with the, I don't know, with all these image, not pictures, how do you call it? Imagenology from hospitals and different e-charts and all this information we can correlate between everything. So today, at least on ourselves, our goal is that these companies can have all this information in one format, in one stand, in one specific be normalized and standardized, so now they can use it. Because your doctor, the problem that your doctor has today is the liability.
Mm-hmm.
If he start to receive a lot of data from yourself, it's like he is going to be, okay, it's too much information, I'm not accountable of all this information. Liability is it's terrible at this point. So he goes to the basics and go to the laboratory with what happened in the heuristic part, in the books, in the hospitals, all the analysis that he already know, and do something only with that information. Because again, it's difficult to receive all these data. Now, there is a lot of companies that are starting to integrate everything, or at least to receive all this information and trying to help them and be a tool. Because the important thing here is we bring tools to the doctors. We are not, it's like Corona. We don't want to replace the coach. We don't want to replace the doctor. On the opposite, rather, we want to encourage them to use more tools to make something with the data. But we are not to diagnose something. We are going to help them to take better decisions about the patient. To your point, it's like we help them to take better decisions with more information, but now we need to make it a little bit more actionable so they can use it.
So
Make sense?
It definitely makes sense. Let me take a step back for a minute because I'm interested in something here. You had a dinner conversation during COVID with a CEO, an insurance CEO, and you came up with this company. With all the stuff that's going, how'd that go about that you came up with ROOK, and you've come up with this company? I'm just very, very fascinated.
Yeah, it was again. It was lucky, honestly. We were in one event in Los Angeles. Before what we are building today, we have a platform before, and we create a wearable. So this was. Oh, sorry, give me 1 second. This I have this only because it's sentimental thing.
Yeah.
We used to do this wearable before. That happened like 7 years ago. During pandemics, everything changed, and during pandemics, the wearable, the retail for us was the fitness clubs, but the fitness clubs were broke during those moments. So we were in an event in Los Angeles with it was an event of fitness, and then in the dinner I was with the big CEO of one big insurance company, and he told me like, "What do you do? What's on you?" And I was like, "Okay, we have this platform and we have this wearable," and we started to connect these wearables because we saw a huge ramp up when we start to integrate the Apple Watch, and then we integrate Polar on our platform. Was very difficult. And he told me, yeah, I know that it's very difficult. We are trying to do it because we want to create premiums, and we want to create more customized insurance policies. And I was, okay, that's interesting. Okay. And he told me, okay, is there any way I can integrate all your skills of your platform in my own platform that I have? Because we were trying to do this since 1 year. And I told him, like, I always say that, like, as a very good entrepreneur, I said, of course, it's very easy to integrate. And yeah, that's how everything started.
No, it's amazing because you were in the fitness clubs, and all of a sudden it kind of died out, and then you have this amazing company that helps fitness clubs, and it's kind of an amazing story. What is it? Do you guys have any problems with HIPAA in terms of, because you're not gathered? Go ahead. I'm sorry.
No. Sorry, I think I have a delay. No, we don't have any type of trouble with HIPAA and GDPR, all these type of things. For us, it's like it's the basics. We came from medical devices. We came from big pharma, and HIPAA, GDPR. This is something that it's on our blood. It's on our bones.
Can you just define those two terms for those listening? Might not know?
Of course, HIPAA and GDPR, it's like you have to be compliant with the information, the PII, which is the personal information of the end user. So it's that every single time that we extract data, we can de-identify, and I will never know that Corona is behind that information. Okay. We de-identify, we tokenize everything. So now we don't know who is the owner of that data. That's it. Okay. And of course, it's a huge process. It's not only how we extract the data, how we keep the data, is the whole process of the company, is how also we share the information, how we send emails, how we retain, how many years we retain the data, where, when, how, why. It's a lot of things around that. It's a cybersecurity at the same time. Yeah. It's like a lot of things with these two rules. So no, we don't have any type of trouble. That's we born on top of HIPAA and GDPR.
Where do you see wearables in the future?
I can see a future where wearables will be in everyone will have a wearable. Probably it's going to be a pill. Probably it's going to be something that you are using like a Whoop. Maybe it's like earrings. I don't know. But everyone is going to have a wearable. In fact, today, I know both of you have a wearable, but I'm 100% that everyone has one. And could be the mobile, your cell phone. It's a wearable. You are tracking a lot of data over there. You are tracking steps. You are tracking also sleep. You are tracking voice. You are tracking, it's a lot of things in one place. Not sure if you remember, guys, Amazon has a wearable before, like 5 years ago. And it was really cool because track your voice. And on top of the voice, they can give you levels of stress. That was amazing, honestly. So it's like also in the phone, you have this type of information. So the future for me, which I don't think is going to be far away, it's like everyone will have this connection with one specific hardware that will give you more information. And then with the AI, that will give you more information about yourself. So it's like it's going to be very crazy because we are becoming robots, honestly, or something.
Well, and I think it's a common thing that's been said around this time that we have access to all of the information in the world at our fingertips, and we seem to be getting dumber as a people.
Yes, we do.
Maybe that's a little harsh or whatever, but the same thing. And I think right now, it sounds like we need you. We need more people like you to take all of this information and boil it down to, hey, Bo, you're at risk of whatever, cholesterol, statin, like you need to start having less red meat, which I don't think is the answer, by the way. Whatever that's probably what Google would spit out right now. I would imagine something like that. But the point being, that's where I was trying to go with that question earlier of like, is your integration coming back to like just tracking, hey, we noticed for your biology, when you have salmon 3 times a week or whatever, I eat sardines often, whatever, we notice that. And when we notice this pattern, when you don't do it, it's worse. When you do it, it's better. I've had that in the past where I drink tart cherry juice. I discovered tart cherry juice. If anyone knows about this, it became a thing in the endurance world. But this craziest thing, one of the biggest, best evidence-based things, and what the research is so strong, double-blind, placebo-controlled trial, meta-analyses, all these great things that you want out of it. But tart cherry juice, guys, go! I have a link somewhere, I'm sure. Go get some. But yeah, I noticed when I was training for triathlon that if I would drink 8 ounces, and I use Cherry Bundy was the company because it's 50 cherries in a thing. When I would drink it, I would have no soreness. I could train however hard I wanted. And then I would travel or something. I wouldn't have any tart cherry juice. I'm like, oh man, I'm like sore. What's going on? And then I realized I didn't have tart cherry juice. So putting these pieces together, we can do this little kind of like soft connection. I'm really in the space. I'm very geeked out on it, like you are as well. But my whole thing about coming back to all this is you know, I'll let you kind of finish off. You talked a little bit about the future, but coming together with how do we just come up with individualized plans? Is there one other question? Because actually I'm talking to one of my other guests from my Bonos Health, David Bidler. I'm going to shout him out. Physiology First. Do you happen to know him? Marco, have you heard of him at all?
No, I don't think so.
First, David Bidler. They have a location. They're a nonprofit in Maine, and they're opening a location in London right now, and they're getting more on the educational side. But he's now getting really deep into the DNA and talking about looking at your genome and saying you have these particular markers, you have these risk factors, and there might be some legitimate conversation about, again, you should not be eating cauliflower or whatever that thing is based on
it's epigenetics at the end of the day, right? So
there's epigenetics, but there's also the you know, what do you have underneath there, right? So but yes.
Yeah, no, I mean, I love what's coming on. Honestly, again, having more information about yourself is knowledge for you. It's better comprehension, and at the end of the day, it's for me. That's my main goal with what we are building at ROOK, is helping. How can we help and we prevent things like the type of things you said before? It's like if you have these patterns and we saw that these specific things happen with you and with the other person that have the same problem, I can give you a warning at least. So I really love it. I really love that possibility to start to bringing you this information so you are aware. Again, aware for me is the most important thing, is give you awareness about something.
I think that
love it.
It's I love it too. So I got a really interesting question for you, because big pharma likes it when we're sick because they got to push their medication on us, right? Right. So that's big pharma. You're doing preventative care. There's a tension there, and my big thing is when you first went, you didn't go to the physician, you went to big pharma. So you've kind of explained why you didn't go to doctors, but there's a tension there. So my question is, as someone who's lived in both worlds, aren't you being disruptive to big pharma?
I don't think so. I know big pharma from clinical trials, right? So I really know how difficult it is to create a protocol. I know how difficult it is to create a brochure. I know how expensive it is to create a clinical trial in the entire world. Very, very weird diseases, from mental to, like Alzheimer, like oncology problems. I mean, too many weird things, diseases, and everything. So I don't think they are. I don't think they are trying to be less preventive. In fact, there is a lot of clinical trials that are trying to find ways to prevent things like Alzheimer, for example. Yeah. So, which is one of the biggest problems. And the only one who has a medication for Alzheimer approved by the FDA, if I remember well, is Eli Lilly. It's Eli. Yes. And it's super difficult. And I think that this is after 20 years, 25 years, that's the first drug that came to the public. So it's so difficult. But to your point, I don't think so. In fact, for example, Roche, they have one the name is, what's the name? Diagnostics. This is only a lab testing. You can share your blood, and they will give you, I don't know, 360 whatever gens, and will let you know exactly what type of problems. That's prevention.
Yeah.
They will give you more or less an idea of the potential problems that you will have eventually, and it's super expensive. But I don't think that they are doing only things for today and to be reactive. I really do believe they are doing something for the prevention side, working in the clinical trials. At least from my experience, I have a different idea about the big pharma. Honestly, it's not only create. I don't think that they create the problems and the solutions. But that's just my idea, and that's why that I was working over there. So
No,
it's one perspective.
Like we
right?
look at it, like we were doing things on GLP-1s. We were talking about that, and that's that's getting kind of out of control. People trying to lose 10 pounds, and a doctor passing out GLP-1s. It's insanity what is going on, but it's the pushing of the big pharma and the pills, because the doctor gets money sometimes for what they push out, and that whole game.
But it was the GLP-1 was because, let me do one step back. The GLP-1 was created for diabetes, right?
100%, yeah.
So, and the reason that it came was because it was an adverse event. An adverse event is something that was not created, that medication.
Correct.
So the doctors saw, and they were reporting that a lot of people who were taking the GLP-1 start to decrease the fat body. And then there's something called off-leveling. Off-leveling is people using that medication for other purposes.
Yeah.
And there was a lot of push because there was no studies about long-term. So the big pharma was like, okay, in fact, the FDA pushed these companies to do studies about this medication with fat people. Not fat people. How do you call it? Sorry, it's like obesity. Sorry,
obesity.
Obesity. Sorry. That's my bad English. Sorry, obesity.
Tú también.
So, lo siento mucho. No quiero offend. I didn't want to offend anyone. It's like obesity. It's the same thing in Spanish. So it's because something happened in the market, and a lot of people started to use off-labeling and start to buy this medication off-labeling. And there is a huge, the FDA and other MOH are pushing them to do these clinical trials and see if there is any type of problem if you are using this medication for other stuff that are not allowed. So again, you have to see the whole picture of why. Of course, it's money in the table. It's a lot of money.
Yeah,
right now, it's a blockbuster. It's
Yeah.
a blockbuster today.
Yeah.
It's helping a lot of people. And now you can see new medications coming. So, for example, Novo is now creating a pill, because the GLP-1, everyone knows it's like with injection, and it's intravenous. So it's IV. But it's like the new medication is going to be a pill, and it's going to be more targeted. So, I mean, it's an opportunity, yes, but also because of the people who is using all these medications off-labeling, right? So it's a mix of things.
On that note, I want to be respectful of everyone's time here, and I actually have a client rolling up in my garage right upstairs. So we're going to do some personal training, and I got to give a quick shout out to my sponsor, Drink Element, their new sparkling here, lemonade sparkling, stay salty. Don't know if you like that one, Marco, but
your client's here in 5 minutes, correct? Your client's going to be starting at 4 o'clock. So why don't we? So Marco, first of all, so we're gonna close the show. That's a wrap. Marco, where can they find you?
All the places: LinkedIn and Instagram as Marco Benitez. My webpage of ROOK is tryrook.io. And please, I will be very happy to have conversations with you.
Listen, I can't thank you enough for being with us. And it was a pleasure meeting you today. If today's episode lit a fire under you, spread the love. Hit that review button, share it, or subscribe. We are sponsored by Fit Care Physiotherapy and Wellness, where the emphasis is to focus on your fitness so you can avoid the healthcare space. Until next time, keep pushing boundaries, keep evolving, and never stop demanding better. Your future self will thank you. Peace.
Thank you.
Listen, man.